Right now, inside your body, there's this incredible balancing act going on. It's the reason your blood flows smoothly, second by second. But if that balance gets thrown off, well, the consequences can be pretty serious. So today, we're going to dive into what that delicate balance is all about and, what happens when it gets tipped.
I mean, you've heard this, right? You're on a long flight and they tell you to get up, walk around, or you hear about certain risks during pregnancy or with different medicines. It all seems kind of random, but the answer to why these things matter is actually tied to one central idea: hypercoagulability. So, to really get this, let's think about our blood system like it's a car. It needs to know exactly when to hit the gas and, just as importantly, when to slam on the brakes. And this slide lays it out perfectly. On one side, you've got the gas pedal, the procoagulants. You get a cut, you need to stop the bleeding fast, so you floor it. This system is absolutely essential for healing. But on the other side, you've got the brakes, the antithrombotics. Their job is to make sure that clotting process doesn't go crazy and start clogging up the whole highway, They keep everything flowing smoothly at the other 99.9% of the time. When your body's healthy, this whole thing is like a seamless dance. The gas and the brakes are in perfect sync, working together, only kicking in when they're absolutely needed. It's a beautiful system. But what happens when that perfect harmony gets disrupted? When the scales tip too far one way or the other? Well, that's exactly when we get into a state of hypercoagulability. And that's all hypercoagulability, or thrombophilia, really is. It's just a fancy term for when the balance is off. Either the gas pedal is stuck to the floor or the brakes have failed, and that leads to clots forming when they shouldn't and where they shouldn't. And this isn't some new idea. We're talking way back in 1856, a physician named Rudolf Virchow pointed to this as one of the three main reasons dangerous clots form. The other two are issues with blood flow, stasis, and damage to the blood vessel itself. And what he figured out back then is still totally fundamental to how we understand this today.
So, where does this imbalance even come from?
Well, for some people, the scales are kind of tipped from day one. These are what we call the inherited or congenital causes. And sticking with our car analogy, this slide shows the two main ways this can happen genetically. First, you could be born with faulty brakes. This means your body just doesn't produce enough of the natural anti-clotting proteins that are supposed to yell, stop. Or, on the flip side, you could have too much gas, where your body just makes too many of the proteins that promote clotting, or the ones it does make are just way too overactive. So for the faulty brake issues, the most common ones are deficiencies in these three key proteins: antithrombin 3, protein C, and protein S. If you're short on any of these, your body just has a really tough time putting a stop to the clotting process once it gets going. Now, on the too much gas side of things, the big one by far is a mutation called Factor V Leiden. And what's wild is just how common this is. We're talking up to 7% of people with European ancestry have it. That means in almost any decent-sized group of people, a few of them could have this predisposition, and they probably have no idea. It basically creates a clotting factor that just won't listen when the brakes tell it to stop. But, and this is a huge but, not all of these inherited conditions carry the same risk, not even close. Look at this chart. That super common Factor V Leiden. It increases your risk of a first blood clot by about 3 to 6 times, which is significant. But then look at a rarer, faulty brake issue like antithrombin 3 deficiency. That can crank up the risk by a staggering 10 to 30 times. The difference is just massive. Okay, so it's not all about genetics. You don't have to be born with this stuff. The scales can also get tipped by things that happen to us during our lives. These are the acquired causes. And this list brings us right back to the question we started with. Things like pregnancy, where your body naturally ramps up clotting factors to get ready for childbirth, or estrogen from birth control pills, which can have a similar effect. And of course, big events like major surgery, a serious injury, or cancer can all flood your system with pro-clotting signals, throwing that delicate balance way off. But out of all these, maybe the most mind-bending, counterintuitive cause is a condition called HIT. It is a true medical paradox. Okay, get this. Heparin is a blood thinner. It's a drug doctors give people to prevent clots. But in a very small number of people, something bizarre happens. Their immune system sees the heparin attached to a platelet protein and thinks it's an invader, so it makes antibodies to attack it. But these antibodies don't just clear it out, They grab on and hit the panic button on all the platelets, sending them into an activation frenzy. So the very drug meant to stop clots ends up causing a massive storm of new, really dangerous ones. It's the cure literally becoming the cause. And here is maybe the most important takeaway of all. These two things, the inherited factors and the acquired ones, they don't live in separate worlds. They can combine. So if someone with a genetic thing, like Factor V Leiden, also has major surgery, their risk doesn't just add up, it multiplies. It's not 1 + 1 = 2. It's more like 1 + 1 = 10. Understanding that interaction is everything. All right, so knowing all of this about the different risk factors, it all leads to a really practical question, right? What do we actually do about it? How do we manage this balance? It kind of seems like the logical next step, doesn't it? If these things exist, shouldn't we all just get screened to find out our risk? Well, it turns out the medical thinking on this is actually way more specific and targeted. See, routine testing for everybody isn't really recommended, because for most people, knowing the result wouldn't actually change anything about their healthcare. Instead, doctors look for specific red flags, like if a clot just appears out of the blue for no obvious reason, especially in someone young, that's a huge trigger for testing. Same goes for a really strong family history, or if a clot shows up in a weird place like the brain or the abdomen. It really all boils down to this one simple but incredibly important question that doctors have to ask. Is knowing the result of this test going to change what we do for the patient? If the answer is yes, if it means someone needs a longer course of blood thinners, or it helps a family member make a safe choice about hormones, then the test is absolutely worth it. If not, it might just create a lot of worry for no real benefit. So, we've looked at this whole delicate balance inside of us, and all the different things, from our genes to our life events, that can tip the scales. But I think the real power here is just in the knowing. Being aware of these tipping points, from that long flight to your family history, it empowers you. It lets you ask smarter questions and make small, informed choices to help your body maintain its amazing, life-sustaining harmony.